Hi, this is Kate Watkins. I'm going to talk a little bit about our COVID-19 data that we have posted on our website today. I am an epidemiologist for Jefferson County Public Health. I've been working here for about 3 years. Normally, in my day-to-day, I am helping our department and supporting our department with all of their data needs, whether that be analysis or database creation, things like that. Since COVID started, I have been doing basically the same things, except everything is COVID related. A little bit about how data informs our response. We use it a lot to work with our policymakers to figure out what community interventions are working for us, what needs to be changed. It also allows us to know when we need to expand our resources, whether that be delivering PPE to our partners or adding more case investigators to contact our cases and the contacts of those cases. It allows us to know which areas of the county are being impacted at a higher rate than others, so we can direct our responses to those areas. It also provides our partners a lot of important information that they need for planning and preparation. We've, for the last month, seen a decline in our number of cases. However, we don't expect that to continue throughout the summer and into the fall, and so it really allows them to know when they really need to be stepping up their resources as well. And it also helps us and supports the scientific community in better understanding this new novel virus. Our data comes from multiple different areas, actually. Our case information comes mostly from the public. When our case investigators reach out to our cases that have tested positive for COVID-19, we interview them and find out where they may have been exposed to the virus and who they may have come into contact with since they've been ill, so that we can follow up with those folks as well and make sure that they're not ill, and if they are ill, getting them tested, and if they are not ill, making sure they stay at home so that they don't infect anyone else. We also get information through death certificates from our state health department, the Colorado Department of Public Health and Environment. Their vital statistics section has been going through all of the death certificates to identify people that we may have missed. We also get information from our hospital partners and through medical record follow-up, especially for people who are currently hospitalized. We also get information from laboratories, both on positive and negative tests, which are both important. We need the negative tests to know how many people we've tested and get a sense of how many positive cases we're seeing. And so that is the website link to our data on our JCPH website. And there's 4 different pages. The first page is the case summary page that tells us, gives us a basic overview of how many cases we've seen, how many deaths, how many people have been hospitalized, how many are currently hospitalized, and how many have recovered. And if you hover over any of these numbers or any of the data in any of the tables, it will give you more information. So for example, for recovered, that is the number of people who have not been hospitalized, who haven't died of COVID, and where 14 days, 2 weeks have passed since they began experiencing symptoms. It also includes people who were hospitalized and have been discharged and have 10 days have passed since that hospital discharged. Let's see. Our first chart here shows the number of cases by report date. This is important for us to look at. It tells us where, if we're increasing cases, if we're decreasing our cases, and whether or not we need to scale up our response or perhaps institute different measures of reducing disease communication. And it occasionally reloads. If you click on either of these 3-day moving averages, this gives us an idea of kind of a smoother rate. You can see that over time we've definitely had some peaks and valleys of our cases, and this allows us to kind of see what the actual trend is over time. And you can see that over the last week, we've actually started to see a little bit of an increase in cases again, which was not unexpected with the movement from stay at home to safer at home, and then from safer at home to the expanded openness that we've seen with stay at home and in the great outdoors. We expected to see some increase in cases when that happened, and we are starting to see that. And the next chart that we look at is by onset date. Onset date is an important tool in epidemiology. It allows us to see not only the trend over time, but actually when people have been infectious and when they've recovered. One of the things that it is easy to see is that the peaks and valleys actually show us the range of our infectious period. So when people are exposed to when they become infected, and then when the people that they've exposed become infected. And so that's what those peaks that you're seeing each time are. Those are our infectious cycles. With this chart, our 3-day and 7-day moving average will always look like it's declining, even if we are seeing an increase in cases. And that's just because of those unreported cases. So if you've been exposed in the last 2 weeks and you're just now experiencing symptoms, you know, it will take maybe a day or two before you go get tested, and then a couple days before we get those test results back. And so there's always this lag when we're looking at onset date. But overall, it's important for us to see the general trend of that onset over time. We also look at the number of deaths that we've had by week. This is important to us to show the severity of the disease currently and in the past. And then we also look at our the date that people are hospitalized due to COVID. This is really important for many reasons. It shows us, again, the severity of the cases, but also it's a good indicator of how our healthcare system is doing and whether or not it is becoming overburdened or not. Right now, we have very few hospitalizations currently, but as the summer and fall progress and we see more cases and more hospitalizations, this will be a very important chart for us to keep an eye on. If you go back up to the top, again, there's these different pages that we can look at. This is our demographics page, and at the top here we have just the overall number of, or the percent of cases by age group, race, ethnicity, and by sex, and also their living situation. The red line here indicates where, like, the percent of our general Jefferson County population, not necessarily the of our cases. So for example, among those under 20, we've only had about 7% of our cases in that age group, but they make up 22% of our population. And so we're seeing less cases in those that are younger, but in our 80+ age groups, they make up over 11% of our cases, whereas they only make up about 4% of our Jefferson County population. Similarly, there's some discrepancies among white non-Hispanics and Hispanics. We're only seeing about 55% of our cases being white non-Hispanic, whereas they make up about 78% of our population. And we're seeing many more cases among our Hispanic population, where they are making up about 26% of our cases, but only about 16% of our population. We also have the same breakdown among our deaths. Similarly, the majority of our deaths are occurring in those over 60 years of age. However, unlike with the just general case information, we're seeing less of a discrepancy. There's still a bit of a discrepancy, but less of a discrepancy between our white non-Hispanics and our Hispanic population. And another thing to point out on this page is the majority of our deaths have been those people residing in an institution, and that includes people in skilled nursing facilities, nursing homes, long-term care facilities, and places like that. Going to our testing page. This page is important for us to keep an eye on to make sure that we are testing enough people to capture a good number of cases, so that, you know, if we're not doing enough testing, we're not going to capture enough people that are actually infected, and we cannot control the spread of the disease then. So Harvard's Global Health Institute has recommended that we be testing about 880 people a day. We have not reached that mark yet. We're trying. We definitely have done a lot of things to improve this and made testing very easily accessible in our community. And anyone that needs to be tested should be able to be tested now. The other thing that we look at, the other goal we have, is to maintain our daily percent positive below 5%. Or below 10% actually, and we've been striving to keep it below 5%. This again indicates that we are testing enough people to find the cases in our population. One thing to note, if you go here on a regular basis, some days our testing numbers are very small, and almost all of them are positive, and so it might look like 100% of our tests are positive. If you come back the next day, the data will have adjusted. We've received more testing information, and that number should drop. So we might have some daily spikes occasionally, which you can kind of see here in the serology testing, where yesterday we had 8% of those tested come back positive. But by tonight, when I upload the data again, that percent most likely will have dropped. And there's a link here for additional information regarding testing if you're curious about how the tests are conducted, where to get tested, and the difference between a PCR test and a serology test. One of the new additions to this dashboard has been the addition of case-specific location geography. In the previous version of the dashboard, we were using city of address versus actual geographic location, which increased case counts in some locations more than actually existed within the city boundaries. For example, Golden has 111 cases, but I think previously they were being reported as having over 200 cases because many of the people living outside of Golden use the Golden City as their address. The blue map, both in the places map and the neighborhood map below, indicate the number of cases, and the purple map shows the rate of the cases. This is important to show the data in both ways. The number of cases tell us where the greatest number of cases are, which populations and which communities are being most impacted just on the grand scale of things. Whereas the rate shows us how burdened the population is. So how many cases per population, and it tells us, yeah, how much that population is being impacted by this, even if they have a lower number of cases. If they also have a lower number of population, that's impacting their population greater. These maps have the option to show different data. The default is the total number of confirmed and probable cases that we have. There's also the total number reported in the last 2 weeks. The total number of deaths per jurisdiction, and the total hospitalizations per jurisdiction as well. And again, so for example, this is a good example of where there's a low number of cases in Kittredge. There's less than 5 cases that have been reported there. However, their rate of hospitalizations among that small population is actually quite high. We also included some testing data. Takes a second to load. For the percent positive PCR test is actually only included in the blue map. There's not a rate associated with that. And so, for example, the rate of percent positives in Lakewood is just about 10 per 1,000 people. We also show the total number of PCR tests that have been conducted and the rate of that testing as well. So Lakewood has had about 748 positive tests, which is a rate of about 4.7 per 1,000 people. We also can see the total number of tests conducted. So again, looking at Lakewood, they have had almost 8,000 tests conducted so far. The same information is shown in neighborhoods. These neighborhoods are created by the Piton Foundation. They are a combination of census tracts, which gives us the ability to look at a little bit smaller scale, but not so small that it becomes difficult to actually report on cases, since we try and maintain confidentiality as much as possible. And at the very bottom is a very simple table that is a summary of the map at the top of the total number of cases and then the total number of cases reported in the last 2 weeks. This is important, especially the cases reported in the last 2 weeks. It allows us to quickly see whether or not there's been an overall increase in cases compared to what we've been seeing previously. And going back, just some key highlights of the data. Since mid-May, we've been slowly declining our number of cases over each week. Could be that we're seeing an increase. It is a little early to tell whether or not that's going to continue or not. We'll know in another week. Since mid-May, the deaths from COVID-19 have been declining week to week, and noted that there is a lag in death data, and so some of these will be increased over time. I know just this last week we had a couple deaths that occurred back in April finally reported to us. So even though our number of deaths, that total number that is on the main page might be increasing each day, it doesn't necessarily mean that our number of deaths is also increasing on a weekly basis. It might be that those are new deaths, newly reported deaths that happened previously. Our hospitalizations, fortunately, have also been declining, and we hope that continues for quite some time. The majority of our folks who have had COVID-19 have been between the ages of 30 and 39 and 50 and 59. Our older adults definitely have been disproportionately impacted. Again, like I said earlier, they make up about 4% of our population, but they account for 11% of our cases. And our Hispanic population has also been disproportionately impacted, with about them making up about 16% of our population, but 26% of our cases. And the majority of our deaths have been in those that have lived in an institution, again, like a long-term care facility or skilled nursing facility. For testing, we, as I mentioned, have not quite reached that 880 tests per day, but we are working towards that. We have maintained for quite some time now our percent positivity being below 10%, which is an excellent indicator that we are testing enough people, even if we're not meeting that 880 tests per day. Testing is vitally important for us. It gives individuals information that they need about their own health so that they can get appropriate treatment and care, and notify their healthcare providers if they do need to come in for treatment that they have been tested and came back as COVID positive or COVID negative. It's also nice to be able to tell your healthcare provider that you've been tested and that you are negative. It also allows us as public health staff to quickly identify our cases and help them understand that they need to self-isolate so that we can prevent the spread of disease to other people, and identify their close contacts so that they can also know that they might have been exposed to someone with COVID-19, and so that they can also do their part in self-quarantining to prevent that spread of the disease further. And it also gives us an accurate picture of how the virus is spreading in our community. If people are not getting tested, we can't follow up with them, and we also don't know if we're going to see an increase in hospitalizations, and we can't prepare our hospitals for that. So testing is definitely vitally important for us. terms of geography, Lakewood has had the greatest number of cases in Jefferson County compared to our other cities, and it has also had the greatest number of deaths. However, Wheat Ridge has had the highest rate of COVID-19, with just under 9 cases per 1,000 people in that community. By neighborhood, Northeast Lakewood has had the greatest number of cases, followed by South Lakewood. And neighborhoods with the highest rate of COVID include Ski Line, Charles Whitlock Recreational Park and Morris Park, and Mount Carvin Park and Westgate. One of the things to point out about these neighborhoods is that they are some of our lower income neighborhoods, and we have been working to make sure that our cases and the contacts of those cases have the resources that they need to maintain their isolation and quarantine, so that they can get the resources that they need while keeping themselves and their families and their neighborhoods safe.